Welcome back, everybody, to the Deep Dive. Today, we are going deep into a formal complaint. This complaint was filed by Heather Harrison
Okay.
and is regarding the medical care that her husband, veteran Ronald Harrison Jr., received within the Atlanta and Dublin VA systems.
Gotcha.
So we're working from excerpts from the formal complaint itself and also some related briefing documents. To get to the heart of what's going on here, it's a complicated situation, but our goal is to extract the really crucial elements and help you understand the core issues and the veteran's experience as Ms. Harrison lays it all out in the complaint.
Right.
And right away, you hit this powerful statement from Mrs. Harrison.
Hmm.
I have spent the last year trying to keep the VA from killing my husband.
Whoa.
So that sets a pretty serious tone for what we're about to get into here.
Yeah, it certainly grabs your attention. And as you go through this material, the weight of these allegations really sinks in.
Yep.
You know, it paints a picture of a system where some really fundamental aspects of providing care seem to have just broken down
Yeah.
and had some potentially really devastating consequences for Mr. Harrison's health.
Okay, let's break it down. The central thread that runs through this complaint is this allegation of systemic negligence across both the Atlanta and Dublin VA facilities.
Oh, right.
Ms. Harrison believes that this pattern of negligence has directly led to a significant decline in her husband's health. And we're talking about multiple strokes, a heart attack, nerve damage, a really serious list of issues.
Yeah.
And a key aspect of this alleged negligence seems to be this failure to review and act on Mr. Harrison's medical records.
That's a pretty fundamental breakdown if you think about just healthcare working well. The ability of a provider to access, understand, and act on a patient's history is just critical.
Right.
And this complaint details several instances where that seems to have gone wrong. Makes you wonder about what protocols are in place or maybe what's missing to make sure this kind of information doesn't just get overlooked, you know, especially as patients move through different parts of the VA.
Totally. For example, the complaint mentions abnormal test results that weren't addressed by Dr. Ghosh at the Dublin VA.
Mm-hmm.
And then later on, a similar situation with NP Ruff at the Atlanta VA.
So this was at different facilities.
These were different providers, different facilities, and her concern is that there wasn't adequate follow-through
Right.
across that transition of care.
Right.
Then you have these brain MRIs from 2022 and 2023. Mrs. Harrison states, and I'm quoting directly from the document here, brain MRIs in 2022 and 2023 revealed abnormalities, yet no follow-up or disclosure was provided.
Wow. What does that kind of lack of action suggest to you?
Well, it seems like a failure in what should be a closed loop.
Right.
If you have a diagnostic test, that indicates a problem, and then that information isn't acted on. It's not followed up on. The patient isn't even informed.
Then the test was essentially pointless.
Right. The value of that test is just negated. And I imagine from the patient's perspective, it just erodes your trust in the whole process.
Yeah. And it gets even more concerning when you look at the 2024 CT scan, which reportedly showed signs of a stroke. The allegation here is that this also wasn't properly addressed.
Mm-hmm.
And despite Mrs. Harrison's repeated requests, her husband didn't receive a referral to a vascular neurologist.
So what are the potential implications of that kind of delay? I mean, if you suspect a stroke, time is of the essence. Right? I mean, immediate diagnosis, intervention, it's all crucial to minimizing those long-term problems.
Yeah.
I mean, that delay can have huge consequences. And I'm talking mobility, speech, even cognitive function.
Absolutely.
So this alleged lack of urgent follow-up, a specialist referral after a scan suggested a stroke, that's deeply concerning.
So moving to another significant issue that this complaint brings up, the difficulties that Mr. Harrison had in getting necessary care from specialists.
And it wasn't just neurology. The complaint details instances of denied or significantly delayed referrals for pulmonology and cardiology as well. When a patient faces hurdles like this across multiple specialties, what does that say to you?
I think it points to a potential systemic problem within the referral process itself, rather than just some isolated incidents. You know, when access to specialists is delayed or denied, it hinders the patient's ability to get the diagnosis and the treatment.
Right.
For complex medical conditions. You know, it creates this bottleneck that prevents them from getting the care they need.
Yeah. The specifics around the pulmonology referrals are very striking. Ms. Harrison mentions that referrals for granulomas in her husband's lungs were denied even after requests from 2 different primary care providers.
Oh, wow.
As of January 29th, 2025. So that's according to the briefing document.
So you have multiple primary care physicians reaching the same conclusion.
Exactly.
That a specialist is needed, What does it say that the request was still denied?
Well, it raises questions about the process for approving or denying those consultations.
Right.
When you have multiple primary care physicians who have a broad overview of the patient's health, all saying we need a specialist,
Right.
and those requests are denied, it suggests a breakdown in that step of making sure someone's getting the appropriate care.
Yeah, it makes you wonder what factors are overriding the judgment of that primary care team.
Yeah. And then there's the neurology referral.
Right.
The complaint describes a delay of nearly a year, which ultimately resulted in a community care appointment that's all the way out in 2026.
Wow, that is a long time, especially in light of what we talk about.
Right.
Those stroke-like symptoms and that abnormal imaging.
Exactly. A year-long delay for a neurology consult with those red flags really points to a serious backlog in the system or a significant inefficiency, in its ability to provide that timely access to specialists.
Absolutely, and it makes you wonder about the strain on the system and the impact on other veterans needing similar care.
Right. This complaint also brings forward some really serious allegations regarding retaliation and patient abandonment.
Okay.
One concerning example involves Dr. Reddy, a cardiologist, who allegedly terminated Mr. Harrison's cardiac care after he had a stent placed.
Mm-hmm.
And the complaint states that this was done without assigning a replacement,
Mm-hmm.
leaving Mr. Harrison, and again I'm quoting here, without necessary cardiac oversight post-stent placement.
So what are the ramifications of a situation like that?
That sounds like a major lapse in the continuity of care, which is so essential after a procedure like that.
Especially after something like a stent placement. Ongoing cardiac oversight is critical
Yeah.
to monitor recovery, to manage any potential complications,
Okay.
and to ensure the long-term effectiveness of the procedure. To leave a patient without that kind of follow-up could have really serious repercussions for their health.
The issues surrounding medical records are also really troubling. Mrs. Harrison reports that VA records from 2001 to 2007 are missing. Despite repeated requests to obtain those records, think about the potential impact on someone's care if a huge chunk of their medical history is just unavailable.
I mean, the accessibility and accuracy of medical records are just so foundational to providing safe and effective healthcare.
Right.
If a patient's history is incomplete or missing, it can lead to all sorts of problems, gaps in understanding their conditions, potential medication conflicts, even unnecessary or duplicated testing.
Right.
So the fact that these records are missing for such a substantial period, that's a major red flag.
And beyond just missing records, there's the issue of improperly managed digital records as well.
Okay.
So the complaint mentions that imaging and test results were being uploaded without proper labeling and documentation. An August 14, 2024 upload is a specific example cited in the document. How can healthcare providers use information effectively if it's not organized and described properly?
I mean, it becomes incredibly difficult, if not impossible, to efficiently locate and interpret that crucial medical information if it's not correctly labeled
Right.
and documented. It's like having a library where all the books are thrown on the shelves with no order or titles. This kind of disorganization leads to delays in diagnosis, errors in treatment planning. It undermines the effectiveness of the whole system.
And it's not just about individual errors, right?
Yeah.
Mrs. Harrison's complaint specifically alleges non-compliance with some key VA directives.
Okay.
These are directives that relate to patient care and communication. And the complaint even lists these directives by name and number. VHA Directive 1088, 1232.5, 1003.04, 1907.01 BO, and 1120.05.
So for our listeners, those cover a range of important areas from communicating test results to the process for consults, patient advocacy, how health information is managed, even disease prevention. So when these directives are allegedly not being followed, what does that suggest about the system as a whole?
Well, the fact that these specific VA directives are being cited as violated, it really points to a potential system-wide failure to adhere to policies and procedures
Right.
that are designed to make sure there's a standard of quality and safety in patient care.
Right, because these directives aren't arbitrary.
Right.
They're put in place for really important reasons. So this alleged non-compliance across multiple directives is a cause for concern.
Yeah, and despite all of these issues that Mrs. Harrison has brought forward, she claims there's a lack of any meaningful response or corrective action from VA leadership. She states, and this is another quote from the complaint, "Despite my extensive efforts to seek resolution through proper channels, I have received no meaningful response or corrective action from VA leadership."
It sounds incredibly frustrating for someone advocating so hard for their spouse.
Mhm.
That lack of responsiveness from leadership, if that's the case, can really compound the initial concern about the quality of care.
Yeah,
It suggests a breakdown in accountability and oversight.
right,
When individuals try to raise serious concerns the right way,
right.
and those concerns aren't addressed, it can lead to feelings of helplessness and a loss of trust.
Absolutely. To really understand the sequence of events and how these issues played out over time, the complaint document has this really detailed timeline.
Okay.
It starts with Mr. Harrison's initial complaints of dizziness back in 2022
Okay.
and that brain MRI that Dr. Ghosh ordered. Then, after transferring to the Atlanta VA in January of 2023, there's this reported lack of follow-up on a whole range of concerns: cardiac issues, sleep apnea, joint problems, muscle atrophy, gout, abnormal lab results.
Mm-hmm.
And the complaint alleges that NP Ruff just ignored the previous records.
So what does that kind of lack of attention to prior history potentially lead to?
Well, it can lead to significant gaps in understanding of the patient's health
Right.
and potentially delay or prevent the diagnosis and management of ongoing issues.
Right. When a provider doesn't review a patient's history, they might miss clues,
Right.
order redundant tests, or fail to recognize patterns that are crucial for effective care.
Right.
It really undermines the point of having a longitudinal medical record in the first place.
Then in March 2024, Mr. Harrison had these stroke-like symptoms.
Okay.
And a head CT on April 2nd, 2024 showed abnormalities. And then there was a neurological e-consult later that month,
Mm-hmm.
which recommended further testing. But it was around this time that the previously undisclosed MRI results from 2022 and 2023 were discovered. What's concerning about the delay in finding those?
Well, it raises serious questions about why those imaging results weren't communicated to the patient and acted on when they happened.
Mhm.
That delay in recognizing and addressing those abnormalities could have had a huge impact on Mr. Harrison's health.
Right.
It really highlights the need for robust systems that ensure these diagnostic findings are properly reviewed, communicated, and acted on
Yeah.
without delay.
By June 2024, the ISN-7 acknowledged improper treatment by NP Ruff. But even after Mr. Harrison's care was transferred to Dr. Williams-Thomas, the complaint alleges that these issues continued. And in fact, missing records nearly led to open heart surgery in August 2024.
Wow.
That really highlights the dangerous consequences of these failures.
Yeah, that near-miss scenario is a stark reminder of just how critical, accurate, and accessible medical records are
Right.
to patient safety. I mean, the fact that a major surgery was almost performed without a complete understanding of his medical history
Yeah.
illustrates the potential for harm when these systems break down.
The issues continued with this miscommunication regarding a neurology appointment.
Okay.
In August 2024, it was scheduled with a seizure specialist instead of a vascular neurologist. And that neurologist couldn't even find the prior imaging.
Oh, wow.
Then there was this conference call on August 19th, 2024, where the complaint says that leadership acknowledged that there had been improper care
Okay.
and suggested that Mrs. Harrison file a federal tort claim.
What does that acknowledgement from leadership potentially signify?
It seems like a recognition at a higher level that there were deficiencies
Right.
in the care provided. And the suggestion to file a federal tort claim is also significant.
Right, because that often indicates a potential legal liability
Yeah.
on the part of the VA for the alleged harm that happened.
But then the situation gets more complex, with conflicting information about whether or not Mr. Harrison actually had a stroke after that neurology visit.
Hmm.
Then a new brain MRI in September 2024 showed evidence of more strokes.
Oh, wow.
And a rescheduled stroke clinic appointment for February 2025 was followed by another last-minute referral to community care with an appointment in 2026.
It just sounds like a really frustrating cycle of delays and missteps.
It does.
This back and forth regarding the stroke diagnosis and then the continued delays.
Right.
In accessing that neurological care, it really does seem like a system struggling to provide timely and accurate treatment
Yeah.
for a serious neurological condition. And then the community care referral with such a distant appointment raises even more questions about the urgency of his care.
Okay, finally, the timeline in the complaint highlights some major diagnostic errors that were later corrected by community care providers. So Mr. Harrison had apparently been misdiagnosed and treated for type 2 diabetes since 2001. That's a mistake that wasn't corrected until a community care endocrinologist saw him in October 2024. And then in November 2024, a community care neurologist diagnosed his muscle atrophy as nerve damage from poorly controlled diabetes. And, On top of that, those pulmonology referrals for those lung granulomas, those were still denied as of January 29, 2025.
Right.
What do these diagnostic errors and their eventual correction suggest to you?
I mean, these errors, some spanning over 2 decades, really underscore the potential consequences of not adequately reviewing medical history
Right.
and potentially the lack of access to the right expertise within the VA system,
Yeah.
at least in Mr. Harrison's case.
Yeah.
The fact that community care providers were able to identify and correct these long-standing issues
Right.
raises questions about the standards of care within the VA.
So to wrap this up for everybody, what we've taken away from this deep dive into Mrs. Harrison's formal complaint and the related documents is a really concerning account of systemic failures, breakdowns in communication, and the potential for serious harm within the VA.
Yes. The core themes that emerge are these repeated instances of ignored medical concerns, significant delays in care, those issues with medical records,
Right.
and the failure to comply with those VA directives. All of these factors, as Mrs. Harrison describes them, seem to have led to this decline in her husband's health.
Yeah, it definitely gives us a lot to think about.
Mm.
Given the allegations and the steps Mrs. Harrison has taken to find a resolution, what does this case highlight for you about the challenges that veterans face when they're trying to navigate these large healthcare systems and ensure that their concerns are being addressed? What questions does this raise for you about accountability and oversight within large organizations like the VA? It's definitely something worth considering.